Fair use, fair use, fair use. All right, y'all. We got to get straight to it. They coming again. I wasn't even on this thing in the beginning, but I'm on here now, so I'm going to warn you. You better prepare you better prepare your family, whatever you need to do. They coming again. I got clips. The elite are making strategies or planning out plans. So that's why we call it the plandemic. They telling you it's coming, but you stuck on your phone. You stuck. You distracted. Cat Williams, Tamara, Power, all these things. The sports. You distracted. You need to learn how to garden. You need to get your immune system stronger. I'm telling y'all, man. Check out these clips. I got some more clips coming next. I got some more clips coming, y'all. I'm finna start dropping more. I gotta get out there for y'all. But I'm telling you, wake up. Wake up. Just pay attention, y'all. I'm telling you, it was supposed to happen 2025. They speeding it up. I got a couple clips on here. It's gonna break it down for you. But the next clip is gonna blow your mind. I promise you. True Talk Lounge. Subscribe, follow, share.
World leaders gathering in Davos, Switzerland this week are going to discuss Disease X, a hypothetical virus 20 times deadlier than COVID-19. Addressing a global pandemic is also something that a next U.S. president might face. But what exactly is a Disease X? According to the World Health Organization, Disease X represents the knowledge that a serious international epidemic could be caused by an unknown pathogen. Let's bring in Dr. Amish Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security. Thanks so much for being with us. COVID-19 has killed almost 7 million people worldwide. What would a virus 20 times deadlier be like? And is that a possibility that we could see in our lifetime?
It's definitely a possibility, because if you look at COVID-19 and compare it, for example, to the 1918 influenza pandemic, you can see that it is magnitudes less deadly than 1918. And there are strains of viruses that have very high mortality rates that could develop the ability to transmit efficiently from human to human. If we did so poorly with something like COVID-19, you can imagine how poorly we would do with something like a 1918 level event.
Do we know, and maybe this is one of the things they're trying to work out, but where a pathogen like that could originate from as these world leaders think about how to combat such a thing?
Likely, these types of pathogens are going to be respiratory viruses, and they may be viruses that are circulating in certain animal species, but are not able to transmit yet efficiently between humans. So that could be in bats, like COVID-19. It could be in birds, like bird flu, or it could be some other type of animal species, swine, for example. And it's really about that interface between humans and animals where interactions are occurring that these types of viruses get a foothold. Most of them will die out, but what we worry about is one that can spread efficiently, the way 1918 did.
And so what kinds of preparations might they be talking about? And are there certain roadblocks that we learned about from COVID-19 that just need to be cleared in terms of, I guess, well, within individual countries, but then also cooperation across countries? What kinds of topics do you think they're talking about as they discuss Disease X?
The whole idea of Disease X is about being proactive, to look at the myriad types of viruses that can infect humans and kind of narrow in on certain viral families that are most likely to harbor a pandemic pathogen and start working in those families, even if we don't know which member of those families, or even if it's an unknown member of those families, might cause it, the next pandemic or epidemic. So that means thinking about what do you need to do to make a vaccine? What are the antiviral targets? What type of diagnostic tests do you need to have in place? Should we be doing wastewater monitoring? All of those types of questions are being contemplated in the effort to be proactive. And what we learned from COVID-19 is that there are obstacles. We have regulatory and bureaucratic obstacles, and we also have this lack of transparency. For example, in the early days of COVID, it was clear in China that this was spreading efficiently from person to person, yet that wasn't the official line from China for some time, and the world was caught flat-footed. So I think there are many roadblocks and many problems from COVID. See now is this distrust between infectious disease physicians, public health practitioners, and the general public, because what happened is politicians injected themselves into this, and then it kind of got filtered through all that tribal lens that politics often brings to an issue, and that's something that we're already seeing problems with, for example, with measles outbreaks in Philadelphia that are fueled by anti-vaccine sentiment. So yes, that is part of it, that people may not actually be receptive to the protective actions that are being recommended by public health officials, and that's going to come back and make things much more harder than they need to be.
We have Life 360 because our kids are growing up.
They're becoming a little bit more independent.
I'll be a teenager in like 11 months.
I just got my first phone.
I can ride my bike to school this year.
Whatever they're doing, we use Life 360 to...
Ladies and gentlemen, esteemed distinguished panelists, it's my pleasure to welcome you to the... You know, we have a catchy title, but I think what's behind is basically how do we prepare for next emergency? How do we prepare our health over next pandemic? We all know very well, there will be viruses, there will be pathogens, there will be outbreaks. The idea is how do we prepare to contain those? How do we prepare outbreaks from becoming full-blown pandemics? We have been working on this for some time, actually. How do we prepare the health system to respond to not just pandemics, but also other crises? We know there is a looming crisis of climate change. That's going to impact our health system. How do we respond to increased number of diseases, whether it's communicable disease, non-communicable disease? We have to prepare. How do we make sure that we have a good global disease surveillance? We have data systems that can be accessed quickly so that private sector can do their job. They can come up with medical countermeasures, whether it's vaccines, diagnostics, or therapeutics. So we've been working on that. We are looking at vaccine equity. We are looking at ways to make sure that there is manufacturing in various parts of the world. Africa was a big example, making sure that we have capacity there to make vaccines in case there is another pandemic. So those are some of the things we've been working on, but I think today we are really grateful for this distinguished panelist here, Dr. Nancy Brown. Nancy is the CEO, Chief Executive Officer of American Heart Association. Nancy, I will hand it over to you to introduce the panelists and take it on from here.
Thank you. Thank you, Sham. Thank you all so much for attending this very important discussion. And I appreciate your opening comments. I have the highest regard for the Center for Health and Healthcare and the work that only the World Economic Forum can do to bring all of the actors together to address, serving as the chair of the Health and Healthcare Governors during January 2020's meeting when we first were planning for what we then know, of course, was a global pandemic. And I admired then, and I continue to admire now, how the World Economic Forum thinks ahead. And so, as Sham said, the goal of our discussion today is to really talk about what can we and should we be doing to make sure our health systems are prepared for any future crisis that might come along that requires global panel of experts here that I'm honored to introduce. And in introducing each of them, I'm going to ask them to give some opening comments as well about the key components, very briefly, that they, each of them, believe health systems should prioritize for an effective response to a potential crisis. And of course, it's our honor always to have Dr. Tedros with us, the Director General of the World Health Organization. And Dr. Tedros.
This may be the question.
Yes, of course. At the highest level, what do you think health systems should prioritize for an effective response to a potential crisis?
I think that's a big question, but I would like to start with especially the disease X. It's attracting a lot of attention, and I hope you have seen in the social media. But it's not a new idea. The first time we used the terminology was in 2018. The discussions were in 2017. I was just new director, and MERS could be one, Zika, Ebola, those we know. But then we said there are things that are unknown that may happen. And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name Disease X. So Disease X is a placeholder for unknown disease. I just wanted to start by clarifying that because there is already a lot of attention. If I may, although COVID came immediately, we were preparing for COVID-like disease. You may even call COVID as the first Disease X. And it may happen again. Of course, there are some people who say, oh, this may create panic. No. It's better actually to anticipate something that may happen because it has happened in our history many times and prepare for it. Yep. We shouldn't face things unprepared. We can prepare for some unknown things as well because there are basic things you can do. Then that takes me to your question, of course. Then we should prepare means it could be an early warning system that could be installed. And then preparedness planning. For instance, with COVID, we have seen it in preparedness planning when our hospitals were stretched beyond their capacity, but both in terms of space and also workforce. How can you have a surge when anything comes, you can expand quickly so you can manage your patients? We lost many people because we couldn't manage them. They could have been saved, but there was no space. There was no enough oxygen. So how can you have a system that can expand when the need comes? This, whatever disease, you should prepare for it. You don't need to know that disease. There are common factors. In terms of supply chain, for instance, the same. So whether it's in health systems or even the private sector, by the way, in research and development, for instance, you can prepare for it. Actually, it started with this Disease X issue with a research and development blueprint. It's a blueprint. And research and development should be at the center also to test drugs, to test other tools. And what I said, the oxygen and the space. So preparing that in all its forms, especially with a focus on primary health care. Yeah. High-income countries were surprised because their investments in the last many decades was on high-tech technology, cutting-edge technology in tertiary services, even robotic surgery. But their investment in primary health care was not there. Even some countries couldn't do contact tracing. So to prepare countries of communities. Even communities can prepare for Disease X. But there are many things that can be done at community level. And then public health education and communication should be at the center. So this is what I would like to say as a start. Thank you.
Preetha Reddy, thank you for being here from India, where you and your family lead a very large healthcare system, Apollo Health. I would love you to introduce a little bit about yourself and your health system, and maybe also answer the brief question, what do you think health systems should do to prioritize?
So I'm Preetha, Vice Chair of healthcare, private sector healthcare group in India. We've been there for 40 years. What we've done in 40 years, I think the learning over the past post-COVID has really, intensified what needs to be done. And Disease X, I know the name seems like a science fiction film, but basically it's something all of us need to be aware and alert, definitely for future times to come, because it's definitely a clear and present danger. I want to draw an analogy with the army, especially the Indian Army. We know that every day the infantry actually prepares for war. You know, they go through intense training, and at any time, if there is war at the border, they're ready to go and face that. I think healthcare workers, healthcare systems now have to look at the future like that at any time anything can happen, and we don't know which side it's going to come from, and there's no going away from that. So I think we have to prepare and be prepared. Like there are alerts for global scenarios. For us, it's usually cyclone or floods. There's a red alert or an orange alert. I think the red alerts have to be flagged much quicker, which means we need to be able to realize that this could be potentially a huge problem. And for that, there's been so much of discussion about AI and how can AI really help us to find and detect the problem.
All right, y'all. Thank y'all for sticking it out. Remember, the next video, way more impactful. Subscribe, share. Don't forget to follow. Shalom.